For over 45 years, Duncan Regional Health has been providing care to the communities in Stevens and Jefferson counties. And while they offer a variety of specialty practices, including cancer, wound, and cardiac care, it does not take long to see what they are most proud of. That's providing quality care to those they do life with. In tonight's Health Watch, we are focusing on one of the specialty clinics, orthopedics and sports medicine. When you walk into Duncan Regional Hospital, you're sure to find a friendly face.
How are you today?
Good.
How you feeling?
Paul Powers is a certified physician's assistant and is well known in the community. And it's not just because he's been serving it for 20 years, but because of the connections that he's made during that time.
We talk about their garden. We talk about their grandkids. I take care of their grandkids. And for us, and we take pride in this as a group of a Duncan Ortho, it's not a cattle herding process. It's a take care of individuals. We take care of families.
A graduate of the University of Oklahoma, Paul had job offers in Oklahoma City and in Norman, but knew that Duncan was where he wanted to call home.
And I'm going to see those kids on the fields. I'm going to see those kids in the gym. I'm going to see those parents in the stands cheering for that kid. I think that means something. I mean, I think that matters to families and to kids. Not that the big cities don't provide that, but I've been there. They don't provide that to that level of, I'm seeing these kids every day in Walmart and in the basketball gym. Big cities, you're not seeing those kids like that.
With kids back in school, a big focus for the clinic this time of year is on sports-related injuries, and they treat it all. Everything from a sprained ankle, turf toe, broken arm, to rotator cuff throwing injuries. And when those things happen, he says one of the best things about turning to Duncan Orthopedics is how quickly you can get in.
The benefit that we have here locally with Lyndall, myself, and Beth, our mid-level practitioners that we have in clinic, we're able to get those kids worked in quickly and seen appropriately by whatever facility or whatever one of our physicians need to see them. We're able to get that worked up, whether it's a simple fracture, a fracture that needs surgery, or more complex multi-ligament injuries in, say, a knee injury. We're able to take care of all of that and get it in appropriate positions.
He says quick access to quality care is something that not only helps the patient, but helps ease parents' fears too.
These parents want to know, how bad is my kid's injury, what am I looking at, and if we weren't here to help provide that, they're having to wait, whether they're going to Dallas or they're getting referred to Oklahoma City or wherever they're having to go, that may be a week or 2 week long process.
He says the joke has always been the further you drive, the better your care, but is quick to point out, DRH Health and its staff have proved that's just not the case.
We're small here local, and we're not a metropolitan area, but our surgeons are skilled. From joint replacements, complex shoulders, knees, hips replacements to complex multi-ligament knee injuries that when I was young, that's a go to the city injury. That's no longer the case. We have local providers that can perform those surgeries and do a fantastic job.
And the team is still growing, even expanding services they offer to include a bone health specialist.
We have two practicing orthopedic surgeons, Dr. Duell and Dr. Wright, both do a tremendous job. Lyndall Morgan, a nurse practitioner, Beth Minson, nurse practitioner, and myself, PA, and we've added Berkeley Faulkner, who's also going to be a nurse practitioner, to our team. So we're expanding our coverage and our ability to handle the numbers that we anticipate in the future, and just to expand our footprint within the community to develop more trust.
From pain management to surgery, even therapy to follow, it can all be done in this one location without the added confusion or intimidation.
We're just here to help. We're not scary guys. We're not going to throw, you're not going to a surgeon and getting thrown on the operating table and immediately going to have surgery. We're going to work that up appropriately and slowly, and we're going to take as much time as we need to for our patients to feel comfortable with the plan.
Our coverage of DRH Health will continue next month with a closer look at some of the more specialized treatments. They include a look at advancements made on joint replacements. Ashley Fitzwater, News Channel 6.